Hi, this is Dr. Ken Richter with your Curbside Consult. Fear. We're living in an age where fear predominates our culture. We're afraid of violence in our communities. We're afraid of infections. We are fearful that we're going to lose our livelihoods and our freedoms. I've been in medicine for over 30 years now, and I have seen fear in the eyes of many patients because of health conditions and of the uncertainty of their future. I have also seen how fear controls behavior. The danger is when fear is coupled with a lack of wisdom and knowledge, then the reaction is irrational behavior. I wish our world was full of people who are guileless. The word guile means skillful deceit. So when fear is used as a tool for those who are guileless, then people can be manipulated into behaviors and people can be controlled by their fear. In a political campaign, look how many times fear is used to portray a negative image of the candidate. In our medical system, tests are ordered by instilling fear into patients. A common headache gets a CT scan when the patient is told that they may have a brain tumor. Is there a reason to get the CT scan? Of course. But it may be more prudent to use common sense and clinical skills. Why do we have fear? We don't understand what can happen with our circumstances. We tend to only understand what we are exposed to. A patient may have a common headache and is doing well, but when they talk to a friend that relates the story of another that has a brain tumor, then the patient immediately becomes fearful and wants to get a scan of the head to rule out a problem. How do we resolve that fear? Well, answer questions and provide information. Ask others that have been in similar circumstances and how they resolve that issue. The bottom line is honesty and transparency with information given with no secondary gain. When the healthcare provider is rewarded for ordering tests and labs, how can you trust that recommendation? When that healthcare provider is answerable to an employer that makes their money from ancillary labs and imaging and consultations, then are we getting a truly unbiased recommendation? Is that provider using fear to sway our decision? So here are some recommendations. My father told me a long time ago, he said, Ken, when someone tells you something that does not make sense, then ask for an explanation. If there is no explanation or an explanation that does not make sense, then put your hand on your wallet and walk away. There are too many times that patients are told what to do without a reason or explanation. There is not another product that we would purchase without first understanding what we are buying, but we blindly do as we are told and get exorbitant charges for medical procedures. Of the many things that I've discovered about direct primary care, one major factor sticks out: transparency and honesty. There is no secondary gain or financial reward for a direct primary care practice when a test is ordered. There is no employer to please or bonus to earn by ordering tests and increasing the cost of care. The patient and the physician in a DPC practice are partners in that care, and truthful education and advice is discussed in a concerned, non-fearful way. Fear is not used as a tool for control. Compassion, care, and education is used to reduce fear, and concerns are addressed as goals of treatment. Look, we're living in a very challenging time right now, and all of us can agree that all we want is for people in leadership to be honest and guileless. We cannot control our world. We can't control the rhetoric of our society. We can, however, take control of our healthcare with direct primary care. And I am so grateful and proud of the many doctors and providers who have taken this bold step to put the patient first. There are many decisions to be made in your healthcare. Don't let fear be the guiding principle of your decisions. This is Dr. Ken Richter with your Curbside Consult.